Well, for many years, we've had a whole range of different non-surgical options to manage weight, involving dietetic support, general lifestyle advice, exercise, and some temporary procedures, including things like gastric balloons. But the last many years, there's been quite a profile concerning the use of weight loss medications, and they have really made a big difference because some patients who I saw previously weren't suitable for surgery. Either they weren't in a way heavy enough to justify it, or they didn't have the medical complications from obesity. But now we have some really strong tools which we can use to help them achieve a healthy weight. So using medications such as the Ozempic, Wegovy, Mounjaro, all have a common purpose, which is to facilitate a patient's change in lifestyle. The two big effects of these drugs is to reduce appetite and to give a sensation of fullness. And that combination allows someone to adjust their diet really effectively because that background food noise is just pushed down, and then your conscious decisions on whether you do or don't eat, what types of food you eat, when you snack, is all much more controllable. Now, going through the different drugs, the Ozempic and Wegovy, which are both the same drug, the reason they have different names is because Wegovy is licensed for weight management, and before the licensing occurred, the drug has been used for many years, and it was called Ozempic. So the use of Wegovy for weight management involves a self-injected medication. After counselling about the side effects, this reduction in appetite and increased feeling of fullness allows you to make these changes in your portion size and allows you to make healthy choices. Gradually building up in the doses is useful so that we control any side effects. And about 1 in 20 patients will get side effects which might preclude them using this drug. They can include headache, nausea, sometimes abdominal cramps, constipation, very occasionally diarrhea. And there are extremely rare side effects of these drugs, which include gallbladder and pancreatitis problems. In fact, even though there is clearly concern about pancreatitis, it is extremely rare, in the order of less than 0.7%. So I think that even though we're very conscious of these risks, the health benefits of using these medications in combination with diet and lifestyle change achieve such a good benefit to your health that it outweighs the risks of these drugs. Now, we gradually build up the doses of Wegovy or Mounjaro, which is the newer drug, and with the change in lifestyle, we can normally expect between 15 and 20% of total body weight loss, which is enough to usually achieve a weight which confers a significant health benefit compared to the starting weight. Of course, one of the really big questions is always how you maintain the weight after this. Clearly, if you stop the drug, the appetite suppression and the feeling of fullness gradually goes away, usually within 10 days to 2 weeks after stopping the drug. And this would lead to weight regain. So normally I'm very clear that we have to instigate long-term measures in lifestyle and diet, but also that we shouldn't suddenly stop the drug. So once we've achieved the 15 or 20% total body weight loss, we will look at using maintenance doses, which is often less frequent or less high as the doses required for achieving the weight loss. And many patients, we will use small amounts on a regular basis and maintain a really healthy weight. The other aspect of using these medications is that I usually prepare most patients who are potentially having bariatric surgery. I use these medications. They are really useful because it instigates significant lifestyle change prior to surgery. The pre-surgical weight loss means that the recovery is so much smoother, and also the habit changes that are reinforced with the surgical procedures, such as sleeve gastrectomy, have already been made, and the transition from pre-surgery habits to post-surgery habits is much more comfortable. So I think these non-surgical weight loss medications are incredibly useful. The non-surgical treatments for weight management, such as the Wegovy and Mounjaro, have a very good safety profile. It's now been prescribed in very large numbers for many years. The drugs, which are called GLP-1 drugs, so drugs like Wegovy, have in fact been used for non-weight loss related conditions for more than 10 years. And we know the safety profile is extremely good. The mild side effects, which usually are manageable, are headache and nausea. Occasionally someone can develop really quite severe constipation, but since we're aware of this, we normally anticipate this by increasing fluid intake, ensuring they have some mild laxatives to keep things moving. Diarrhea and abdominal cramps can occur, usually are self-limited and just last for a few days or worst case a week, but we can manage this as well. The incredibly rare side effects like precipitating gallbladder problems or pancreatitis is about 0.7%. So it is rare. And of course, if this happens, this is to be managed, and then we would not use the medication. But overall, the benefits far outweigh the risks. From the point of view of how effective the drugs are compared to surgery, well, on average, a patient who makes lifestyle changes combined with Mounjaro can achieve about 20% total body weight loss, whereas the surgical procedures were in the order of 30% or more if they fully engage with the changes. The important changes that we need to achieve weight loss, especially when we're aiming for significant weight loss, as we are when we're using the medications or even the surgical procedures, is that we maintain nutritional important aspects of protein, fiber, vitamins and minerals, and some exercise. The weight loss with Wegovy and Mounjaro can be fairly rapid in the first few months, and it's really important to not lose too much lean body mass. I often encourage patients to use a body composition analyzer, because then you can get a really good estimate of where you are at the start from the point of view of muscle mass. Resistance training is really helpful to maintain the muscle mass. Taking at least 50 to 75 grams of protein per day, taking a multivitamin, calcium and vitamin D supplements, particularly in ladies, and keeping well hydrated. Combine that with resistance training and the weight loss achieved, you can keep very fit during the process. The medications work by focusing on a number of receptors in the body. Now, the main receptors for Wegovy are called GLP-1, and the main receptors for Mounjaro is GLP-1 and GIP. There are, however, indirect effects on other hormones in the body. We know that there's the stabilization of blood sugars. We know that the appetite reduction occurs. We know that it slows down the movements in the stomach, which aids the fullness feeling. But also there are some indirect effects on other types of chemicals in the body, such as dopamine. And we do find that patients have less impulsive behavior. People tend to drink less alcohol. Patients who have binge eating disorders tend to significantly reduce their amount of binge eating or even stop. So the mechanism, there's certain aspects we're fairly clear on, and the indirect aspects, which are giving a really positive benefit, we're less clear about. But we will find out gradually over the years more and more benefits. We're seeing benefits on reduction of significant cardiac events, reduced stroke rates, improved kidney function. There's a lot of research going on at the moment, but it does seem that there is more than just a focused effect on the specific receptors, but indirect effects as well. So these weight loss drugs are people who are significantly overweight or obese. Some patients will be on other medications that I would, during our discussion, discuss, and the potential impact. Because of the slow stomach emptying, we have to be very aware of the other medications patients are taking and ensure that it is complementary to everything they're doing.